The randomness of nothing brings a special guest today, and I'm very honored to have him on today. Dr. Tommy Rhee, the former chiropractor for the Tampa Bay Buccaneers, Navy veteran, as well as the doctor for UCLA, and has worked with world-class athletes across the spectrum, now brings his very special tactics and medicines to this show to be able to educate and inform people about his product Regen and all the things chiropractic. Thank you, sir.
Thank you very much, and I'm excited to talk to your listeners.
Man, I always get kind of stunned when you Google somebody and the search results are really, really heavy, right? And, the accomplishments you do speak for yourself. And I'm really pumped because, you have a very specialty, when it comes to chiropractic work in people's pain and managing that, I think is a wonderful field that you've gotten into. And this is coming from a guy who's had a back injury.
Yeah. The big thing with in my field as a provider is the ability to listen, and then really try to, become as one, hone into their issues and understand what they're dealing with and what they want to do. What is their ultimate goal? Do they want to return back to a workout, running, event like that? And then from there, you want to say to yourself, okay, what type of equipment can get him that way, right? Is it what we had in the past, or is it the present, or even the future? Just try to imagine how can we speed him up to get to that goal of being pain-free.
Right. And so what actually inspired you to come into, chiropractic medicine in the first place? Was it something you saw, or was it a family of doctors and practitioners? Was it something you saw early? Were you always fascinated by the human body?
Yeah. So I grew up, my dad was a doctor, right? He was a surgeon. And when he came to the United States, he continued on being a provider, but he was a family doc. But the thing is that, I was always around that environment, seeing him, take care of patients, care for them. And it genetically got into me as far as helping people and provide and, taking care of them. It's just that I was a very active person. I played sports, played high school and college football. Something like, well, it's just a great type of marriage between like the physical side, being in the team world, and of course, provider, doctor. So, and then I was thinking like, well, a lot of athletes, when you go into this world, they really care about the preventative stuff. They want the non-invasive, the non-surgical, and they really want to think about like how can you prevent injuries. And it started, chiropractic and the sports side started really getting big out there. And then I found this great doctor. His name is Santos out there in California, and I saw what he was doing, and I just followed that route. And then with that, when you're good and you really can tune into the athlete, it leads you to great places. From UCLA to the Tampa Bay Buccaneers, WWE, Olympic level. It just keeps going from that point on because they're looking, athletes are looking for someone like me out there that really tunes into your issues. So, yeah.
Well, the thing is, too, is like, they have a short, limited window to be successful in their field of work, right? So, and they put a lot of stress and taxing on their body at a very early age. You have to, in order to compete at that level, you're 5, 6, 7 years old, competing in junior high, high school, etc. And then you're doing either intramural leagues or anything. Like you're a year round. So by the time you reach 20 years old, you've been at this for 15 years. And that takes a tremendous toll physically on their back and other things physically. So having somebody who's in the science of it and they need a quick recovery time to be at their peak performance and or earning power at the same time.
Yeah. So that goes in line with, knowing the athlete, but also experiencing, let's, you take someone that's just graduated from school and you take someone that's meted in season. Well, I've seen the course of action when it comes to people that train year round and where you kind of push that envelope of like overtraining. And then you have to understand that you got to back things off. You have to talk to the coach, talk to the athlete, and tell them, hey, we're getting to the point of not having the ability to recover from these type of workouts or injuries. So that's one point. And then you get a new guy that understands the concept but hasn't really felt it, felt it like being in a sport event that it's really happening at that time. And then,
absolutely.
So they learn through their lessons, but someone like me, I've been through that lesson. I've seen every aspect of like the caliber of athletes and the kind of pushing and what type of like mental state you have to be. So it's a kind of interesting world. Like I think it's like nonchalant, like, oh, no big deal because I've been through it. So when you see these athletes or just normal people that are concerned about their pain, you want to find someone like me, a sports guy that's really understanding about activity, biomechanics, and movement because you want to continue on being that person. So, that's why I think it's very important to get that experience as fast as you can as far as a provider.
I thought it was interesting, and I suffered a herniated disc, and I don't, for anybody who's ever suffered a back injury, it is one of the most painful, debilitating injuries that you can imagine because there's just no relief, right? And, you consider yourself pretty pretty stable, but the way that the back operates and function, they're tricky, right? You can't isolate it, so to speak. It's, tying a shoe becomes a four-step process involved with it. And it really was one of the most painful things. It'll put you in tears. It really will.
Especially if you really don't know which direction that herniation went. There's many like path it goes. It goes like posterior, lateral, wherever it's going. But
right.
What you want to do is get the best diagnosing tool, right? An MRI, and then from there find a provider that understands that type of herniation. How far has it gone? And then you have to understand what mechanism or exercises can prevent it and really enhance the ability to heal faster. So there's a lot of techniques out there. And then one cookie cutter is not going to work every herniation. You've got to find someone that understands exactly how you move, because your anatomy, my anatomy, everybody's anatomy is different. You just have to understand what they're working with and then, move it into the side where it's going to heal faster instead of like counterproductively make it worse. So you don't want to have a herniation get worse because you're doing the wrong exercise or movement. So it's all about tuning in.
Without question. And I thought one of the fascinating things about your background was obviously the your regenerative medicine. So you have a brand new creation that's called Regen. I'd love to dive into that because it seems like it's revolutionary, and all the testimonials that I watched about it, is really cutting edge technology and non-invasive treatment, which obviously people are looking forward to. They're not getting cut open. They're not getting surgical procedures. So can you talk about the development of that product, please?
Yeah. So regenerative medicine, stem cell therapy, just think about what's going on right now. So you hear about these keywords or these buzzwords, stem cell, right? People say, hey, I'm getting stem cells, I'm getting live cells, and I feel great, I feel younger and stuff. Then you have to ask yourself, well, what's really going on? Then you have to understand that, are you looking for the cells with these DNAs, right? And then are you going for that? Because that DNA is not going to match your DNA. It's not going to replicate, right? So is it really about live cell, or is it about the signal? Signals is more possible. Now you're looking at things that we have in our body that signals from a hormone side of it. It tells our organs to do things. So it's about the signaling. So because of that, now you're looking at delivery system. So I want the signal, but the only way I get it is either an IV or an injection. Some people take probably like a nasal spray, but it's a difficult task of getting it to your body. So when I work with my athletes, we always had discussions about how can we get this to our body so then I can have this during the season. Because if you do a regenerative medicine or stem cell therapy during the season, there's downtime. You don't want downtime, because downtime means, taking money out of your pocket, because in the NFL, it's about performance and getting on the field.
Absolutely.
So they wanted some delivery system that's faster, and that's how Topical came out. When you look at Topical and these signals that you're trying to get to the damaged tissue, well, it's a smaller molecule, and the neat thing about it's cell-free. So the big thing that you have to worry about when you put a live cell in your body, it may create this like abnormal growth, maybe a tumor formation. You don't know what's going to happen. So when you have a cell-free, well, there's not that DNA component there. Now it's just giving you signals that tell your existing tissue turn on. So once I saw that avenue, I'm like, that's where it's at, because I've been in regenerative medicine since 2008, back in prolotherapy, then it goes to PRP, then stem cell world, and now where the future is a topical application. So where the future is really moving into is, you're getting these cells and these signals from human tissue. Well, it's going to start moving into the world of botanica, plants. Plants have the same signalings as these type of human tissue. You just have to get the right signals. So that's where the future is going to evolve into. And then I'm really honing to that. And I've got some great news and a couple more, I say a month or two, of exactly what I have done. So I'll tell you more about it right now. Yeah. I got to protect my stuff right now, because, it's got a patent and all that stuff.
And so listen, we're not here to put anybody in this position where they put their work in and then they don't get, compensated, or they spill the secrets to Coca-Cola, so to speak. So whatever you need to keep proprietary that you've worked for, that's what you need to do. What I found fascinating about it is that, you work with all broad levels of athletes. And I asked that only because, are there different processes for a boxer versus an NFL player versus an Olympic track runner, so to speak? Like, what are the differences in treatment involved with them, even though they're both all three are performing at a high level? Clearly, boxing is one of the more, you're getting concussed and hit and punched. I love boxing. And, but there's a reason why I stopped doing it, because I was like, I don't know about these punches to the face, man.
That's what it is. the trauma. You're looking at trauma. So boxing has the components of the workout, getting sore from the workout, and then the shots to the face, the body, and you have to recover from that. So there is a cycle of understanding your body and how to recover from something. So if it's your trainer, your provider, your doctor has to understand, all right, I'm going to have this set of exercises or this kind of like, these rounds, these practice and all that stuff. I need days after that to recover from that. You don't want to keep pounding on, because then you'll start doing that thing called overtraining, and then you're not going to actually build muscle. You're destroying it down, and then there goes your cartilage, tendons. So it's that. So boxing is a series of like almost like mini series, right? You got a training season, and then you got the event, and then you got a lot of downtime to recover from that one. And in that training season, it's just like a game. It's just like a season. You've got to cycle and make sure that you understand that this week I'm pushing. Tuesday, Thursday is a hard day. Monday and Tuesday recovery days, and then ring day Sunday or something. And there's a pattern there. So now when you go to tracks like that too. But the interesting about like boxing. Boxing is not so much one max rep. It's not a blast. You get a couple repetition of jab, jab, jab. Then here comes it, right. So you're conserving, and then you're going all out. Whereas track, it's one blast, one max rep. It's the run of your life. 100%. You're trying to destroy tissue because you want the best performance.
Yeah.
That's a different training session. So you never do that real max in totality. You want to just do like a max of the block work. Then maybe the transition, and then the dry phase, and all these things that you have to like max in pieces, but you can't do the totality of it because that's too much trauma to your body. So that's another set of training, right? Just like anything else, pieces and recovery, and make sure that you're able to be 100% for that event to max out the 100% for the whole entire race.
That's wonderful.
Yeah.
That's wonderful.
So football is like boxing, right? You hear about football, the coaches are getting smarter with contact, because contact, it's a necessity you need, because you have to feel it. So when you go to the game, it's not like a shock to your body. But then you have to have that good balance of like, don't go into too much of that contact sport during practice, because now you're being like more like detrimental to your recovery. So you have to have a good balance. So the coaches should know that good balance. And again, I feel that during this period of season, coming close to the game, it's like trauma. It's like you're just trying to keep him on the field. It's not so much the recovery. Right. So that's why it's very important that you're looking at just keeping them on the field, trying to get them back on the field quick as possible. And if they have to strain, there's a lot of equipment, a lot of devices that can help them speed up their healing. And then the one missing component was stem cell therapy. But now the topical, it allows them to continue on with the play. You just rub it on your skin, and it goes right through the skin into the damaged tissue, and it does the same signaling as the injection. So that's the trend. It's going to be fantastic. And the great thing about this is that the way stem cell works is that you have to go to a clinic. There's going to be a medical doctor. It's going to evaluate you, do some x-rays, MRIs, and then, assess, and then they're going to inject the area with these stem cells, right? And then you have a downtime, you recover, and then do some therapy after that. Well, now with topical, you can eliminate majority of that. When you eliminate that, you're cutting on a lot of costs. You're talking about the doctor, the facility, now that it's getting cheaper and cheaper. And the cool thing about it, it's in the patient's hands. When it's in the patient's hand, now they can do it. They don't have to like go and drive. They're just applying it in a home.
Right.
And once it evolves to the plant-based, now you're talking about a lot cheaper, a lot safer. And the most important, exactly. So that's what I'm excited about. This whole regenerative medicine is moving towards, in my world, musculoskeletal, right? It's trying to be active when you get to the 80s, 90s. Right. And that will bleed into not just your physical side, but the mental, because, if you get injured, you remember how when you were hurt, you're like, man, I'm depressed. I can't play. I can't do nothing. It just plays havoc on your psyche, So that's why I feel real comfortable where the future is moving towards for all of us, not just like the athlete, but everybody in general.
Well, I always find it fascinating too. It's almost like, obviously this is like, it's almost like Botox, right? Like before it was exclusively held to a certain group of people, when it came to, whether celebrities or high level, it was, things are sometimes exclusive. Like it's almost like in the lockbox and, in the pharmacy where you got to ask somebody to get to it. But now these things are on the general shelf for the general public, because now the benefit, the cost of barrier has become lower. The accessibility has become, better. The soccer mom who wants to, get her wrinkles out of her forehead. Like, okay, I can do a Botox injection. It doesn't cost as much as somebody who would be in Hollywood, but it still can service me, looking good at home with my family. So to your point, Regen is really good because if you are that, martial arts practitioner like myself, you can be like, hey, I'm never going to be in the UFC or never going to be a high level, martial artist, but I still have to deal with injuries and recovery. That's something that can be accessible to somebody like myself where 15, 20 years ago, it just wasn't.
Yeah. Not only now, I always see, people like us, we're very active, right? So
Right.
we want to stay active beyond this age, right? We want to get to the 70s, 80s.
Mm-hmm.
So the luxury of my office, I get to see everyone from the professional world to the retirees to the
Beautiful.
80 plus. And I see, you have the typical one that are very active and the one that are not active, right? You
Right.
can see how they progress in their age as far as, being able to do a walk or enjoying their retirement and then seeing where they're at. And the one component is activity and
Yes.
not having that little bit of like athleticism and leg strength.
Yes.
When you miss those components, it's like almost like walking on stilts because you have weak legs, you're depending on your upper bodies.
Gosh.
I know, yeah, it's all about being active and strength and knowing where you want to go in that 80, 90 years.
Without question. So when you were in transitioning from you also have your chiropractic service as well too, your private practice as well too. What does that encompass, and how big is your team?
Okay, so I still have that practice
Yes.
right now. So
correct.
So it's it consists of like a manage. I've got like a facility manager, myself as a provider, a couple assistants, and then I think it's probably about like 7 people involved with my team. And our office is unique. Our office is really like the last or maybe a third opinion before you have to do like surgery or you're having a problem from post-op surgery condition that is not getting better. This is the kind of office you want to go to.
Wonderful.
We like those unique cases. We want to see like problems with other physical therapists, chiropractors, or you don't want surgery. Come see us. Tell me what your complication is, and let's work together. Because it's about working together. Because I always see that if the patient and the provider are not on the same page, therapy is not going to do well. You've got to really trust each other, both directions, right? The patient has to be compliant. The doctor has to be, compliant in the sense that I know what I'm doing and I'm going to go ahead and take care of you and make sure that I meet your goals at the end.
Absolutely. One of the things that I think that people don't realize about a back injury is it can happen very quickly, right? And, the sudden, and I speak from a very, very, personal standpoint. You could be literally just bending over to pick something up, right? And it completely just go south very quickly. And I don't think, I'm a pretty avid gym goer, martial artist. There was nothing more debilitating than that, right? And it really is a soul sucking experience because even basic movement becomes a very big challenge. And then, like you said, it takes a very large mental toll on people, right? Because when you do gain that mobility back, you realize how much more you appreciate it, and it's those subtle movements where, it's the gradual wins when things start taking place. And, when you start getting people that say they want to start cracking your back open and putting cages in it and bone grafts in it, you really start to say, that's a bit much. This is not just drawing blood here. This is some serious stuff.
Yeah. So one of the common threads that I have with people with low back pain, it's leg strength. It's always leg strength and the flexibility in your hamstring.
Yes.
So it's common. So think about if you're bending over and you have tight hamstrings, your hips, what they call the hip joint, right? So they call it the femoral acetatum joint. It doesn't flex forward, doesn't move forward. So the next joint is your lumbar. So now your lumbar, if you want to pick something up, you have to do an excess of flexion, like bending forward, right? Yes. Once your joint move, your lumbar shouldn't move as much as you think they should move, right? It should be core, right? That's straight core stabilization, right? So your motion should be like the pistons in your legs. Your legs are the ones that do the stroking and the movement. Your core is like needs to be stable and tight, so it doesn't have that kind of torsion in the lumbar where
exactly.
So when you start doing some unique things and you load it up, you take your lumbar and you move it in a certain angle. It's just like a peanut butter and jelly sandwich. You squish it, and here comes the peanut butter and jelly out the side of the old crust. And then next thing you know it, you're grabbing everything. You're like, it's a shot. It's like, felt like I have it too, so I know exactly what that feels like.
It was like you get hit with a baseball bat, right? I equate it with, the donut with the jelly inside of it, and the jelly came out, right?
Yep, that's
So
exactly what it is.
100%. And so, and you start all the things that you start thinking about flexibility, core strength, right? Especially men, right? Because I still have a psychological thing where if I go to the gym, if I don't lift weights, I didn't actually work out. When in reality, it's the calisthenics, it's the core work, right? But you see, you go in there or you go to your basement, you're like, I'm going to work out, and working out isn't doing, Pilates. And when in reality, that's going to save you a lot of this trouble.
Mhm. Hey, you know what's funny? Like, remember when we were young, we were like stretching out, man. That's come on, we don't
Man,
need to stretch
come
out. What are you
on.
talking about?
Sure, 150%. What? I want to play basketball, man. Come on, don't put the basketball on the court, man. I don't want to spend
I,
20 minutes stretching. No, what's this?
I
This ain't playing.
Yeah, I remember sitting. Yeah, remember like we were sitting down and goes, all right, next up, it's a boom, we're going full court, going fast. And
Yep.
then now it's like you just have to say, wait a minute now, I need about 15 minutes of warm the knee, the ankle, the back. Let me go
Oh
through my
man,
whole dynamic stretches.
100%. I do Muay Thai and I do jujitsu, right? And if you go in there cold, God help you. I
Yeah.
mean, God help you. Not happening. You know what I mean? Like you better dose yourself with some holy water before you go on there, because when you get out of it, you will tear, strain, or pull something. You know what I mean?
It's like,
Not happening.
but the funny thing is that, like there's gonna be a lot of people that understand this, but guys like us, that we used to go fast, right? And then
Mm-hmm.
once you get that big initial, that herniated disc, that
Mm-hmm.
lumbar that gives you that shot, the next time you go cold turkey into a workout, you stop and go, wait a minute now. The last time I did this, I got shot in the back. Let me go ahead and warm this sucker up. So
100%. Yep.
it's
Yep.
almost like we have to go through that. We have to go through that trauma. That oh my god, like
Yep.
remember those times your back hurts so bad that your testicles hurt? Like, holy
Oh my
yeah.
gosh, man.
Remember?
Oh my gosh. It was,
Yeah.
I mean, every part of the body that would hurt, like you said, the groin area. I mean, you would hit, you drive over if you hit a pothole, it was a teeth chattering moment, man. You're like, oh my God. It cannot be, this can't be this painful all the time, right? So yeah, yeah, I'm reliving some traumatic moments here,
Yeah, man. Hey, you're gonna stretch out in a couple minutes now because wait a minute, I don't want that no more.
100%. Hey, listen, when you're the youngest guy in physical therapy, you start getting humbled real quick. You know what I mean? They're looking over there like, yo, man, this is, there's a time and a place that I'm supposed to be here. This isn't the age that's supposed to have happen.
Hey,
Where?
and also, do you know that interesting how females live longer than males, right?
Yes.
The one thing I noticed about that is that we all age, right? No matter what, we're going to age, but there's some, secrets that we can do as far as like,
Right.
slow that down. But the one thing that I noticed is that it's about flexibility. And females
Yes.
are more flexible than males. So
Without
when
question.
males have that rigidity, right? You're talking
Mm-hmm.
about like your arteries kind of like tighten up and you start getting like the hardening. You don't want that hardened artery. You want
Yeah.
that kind of like that loose kind of
Oh, yeah.
movement. So that's why flexibility is so important. Keep stretching, keep elongating. So
Yes.
I do it all the
Yes.
time.
It's what's wonderful and beautiful work. Where can people find Regen and Dr. Tommy Rhee and all the wonderful services and things that you've done to provide? I love asking questions like that, but particularly you, because you have such a personal touch and it impacts people so greatly on their personal and health level.
Oh man, thank you very much. You can go by website, which is Regen, RHEEGEN.com. And then you can see, you can read about me, of course, and then you can see what this whole evolution of stem cell therapy and the topical and my product. And if you have any questions, there's an info button. Hit info, shoot me a question, and I can help you along with that. And of course, I have a book because the book helps me answer a lot of questions that I keep answering over and over again. So if you go to Amazon.com, you
Yeah.
can just basically type in there the future of regenerative medicine and my last name Rhee, and you'll see the book. And you can just, if you have questions, it gives you a nice, easy, like an entry point, how and why and all that stuff about regenerative medicine.
I think that the work that you do and the people that you've impacted, I mean, when I got my ability to walk back, it was like, it's hard to describe the feeling that you have, non-athletic required when you start scoring those small victories. And so, the work that you do, I'm sure you've had many people, hug you and cry and thank you. I know sometimes people cliche, oh, you hurt your back, but the reality about it is it's one of the most debilitating injuries you can possibly imagine. And I just got a small taste of what that was like. So knowing that the people you've impacted and helped, I can't say enough.
Thank you very much, man. I appreciate that.
Dr. Tommy Rhee, this is the Randomness of Nothing podcast, and I appreciate you and your time. Thank you. Stay warm down there in beautiful Florida.
And stay warm up there.
I'm trying. Thank you.